in the spotlight. Today we have one gentleman and a woman from the Ministry of Health. I have on my far right Madam Senabu Ngak, a nurse, senior health nurse and economist at the Ministry of Health. And then on my far right is Dr. Lamin Makalo, who is also a consultant pediatrician. Today our topic of discussion would be shining the light on pre-testing for sickle cell. Before we go further, I would allow Dr. Makalo to actually tell us a little bit about, the disease and his experience, because he has been, working on this disease for quite a number of time. Doctor, welcome to the FATO Network.
Okay, thank you very much, Alo, for the opportunity, and I want to say good evening to our viewers too. This is a very important, discussion. Discussion on sickle cell disease. Was in Africa, they said it's a neglected disease. So people don't know much about it, and it's definitely very common in our societies. It's causing a lot of trouble, a lot of economic impact is very high. That's why it's important for us to discuss it. So if you say sickle cell disease is an inherited disease of hemoglobin. Hemoglobin is the oxygen carrying protein in the blood. It will take somebody to get it from both parents, like the mother and the father. That's how it is transmitted. So, like if a child who is having the anemic state, that is what you call SS state, can see the symptoms, signs and symptoms of it in the child from as early as age 3 months, 5 months. You can see them, with that painful hand and feet. And then thereafter you see them, they have frequent, anemia. See jaundice, that's the yellowish coloration of the eyes. And sometimes, as early as 2 years, they can develop stroke. They will have abdominal distension due to maybe the spleen, pulling of the blood in the spleen, and even the liver. Sometimes they can have, difficulty in breathing, what we call acute chest syndrome. Very severe difficulty in breathing. Like if you don't intervene, one can die. At times, sometimes you see them, they have what they call infections. Infections that can even destroy the bone. But I've seen, cases like that where somebody lost all the bones of the lower limb and the upper limb. You can see, like, some of them, they will develop that as early as 1 year. So at times, they will have problems with what they call priapism, that is painful, persistent erection of the penis.
That's for male children.
Yeah, that is very, and it's very, very painful. Sometimes you can even amputate the penis to the extent that the person will not be able to get intimate. So very, very difficult sometimes. Sometimes they can have leg ulcers, severe leg ulcers. And if you look at them, most of them, sometimes they spend a lot of time at the hospital. They don't go to school, and the parents will spend a lot of money on them. That is, all what they earn, is spent on medications, lab investigations, and many other things. So this is the nature of the disease. So if you look at the burden of the disease, like sub-Saharan Africa here, close to something like 300,000 babies are born with the disease.
You talked about, initially you talked about the disease being neglected.
Yeah.
Is it that it's not very common, that is why it is neglected, or is it related to some spiritual or beliefs that Gambians or Africans have?
Yes. Yes. Maybe because of the poor diagnostic facilities, before people even know that you have sickle cell disease, it takes time. Sometimes because of maybe in our environment, most people would think that maybe it's the genes, or the devil, attacking the person, or they are trying to discipline when the person is expressing the pain, showing the manifestation of the pain. So some people would think that maybe witchcraft. Some people associate with witchcraft, devils, and many other things. That is it. So and because of the lack of that diagnostic facilities, people don't know. So sometimes people die even before they are diagnosed. That's why they call it neglected disease in Africa. But now people are now trying to put attention on it. That's why I can see the hospitals, even in our country, people are trying to get the diagnostic facilities on, and then the treatment also, and then try to raise awareness. That's why today we are here. So as I said, even this coming Friday at Edward Francis Morgan Hospital, we'll have a screening test. Yeah.
So before we go there, Doctor, we have a lot to discuss, and I have a lot of questions to ask because you made mention of. We will look at the statistics and then your experience in the disease. But first, let me engage Madam Nyachak here, who has been very silent. She's a nurse. Initially, when I said Nyachak, she was like, add the nurse aspect of it. All right. So, Madam, tell us a little bit about the importance of pre-testing, before marriage. Simply because a lot of people go into marriage without having to know who they are getting married to. And from his explanation, it shows that the disease is actually inherited. So why is screening important before getting married?
Okay, good evening, viewers. I am Sarah Tengak, a senior nurse and a senior health economist at the Ministry of Health. The question, thank you very much, Ali, for that question about premarital testing, genotype testing for sickle cell disease. It's quite important, as Doctor has rightly mentioned. Sickle cell disease is an hereditary disease that you inherit from either or both parents. We have a sickle cell trait, that is AS, and we have sickle cell disease, that is SS. In the hemoglobin part of the blood, you have the normal hemoglobin is AA, but the sickle cell trait hemoglobin is AS.
Let me interject before you, because when you say AA, SS, like people like me who are not into the sciences are confused. Could you tell us what is this AA means and what this SS means, so at least people get to understand what it means?
AA is the normal hemoglobin, and AS is the sickle cell trait. That is like it is half normal and half sickle cell. Okay. That's why you have A and you have the S. And SS is the sickle cell disease. That is the complete sickle cell, because all the hemoglobin are sickle shape instead of the oval shape, which is the normal shape of the hemoglobin. That's why it is called sickle cell disease, because the red blood cells, the hemoglobin of the red blood cells, instead of being oval shape, that makes it to be able to move through the tissues to transport oxygen, is being the morphology or the shape of the hemoglobin is distorted. Instead of being oval, it is sickle shape. That tool that is used in cutting rice. So
sickle, like just like sickle.
Yes, that's how the name of the disease came about. Okay. So AA is the normal hemoglobin, and AS is the sickle cell trait, and SS is the sickle cell disease. So when you're doing premarital genotype testing, it's important, because when you do testing and you know that you are normal, like AA, then you can marry someone else, any person. You can marry to a sickle cell person or somebody who has AS, no problem. But any person who has S in their genotype, whether it's AS, that is the half normal and half sickle hemoglobin, or the SS, that is the fully abnormal hemoglobin, they should not marry to any other person who has S in their hemoglobin, either is AS or SS. So AS and AS, that is half normal, half hemoglobin, these two partners are incompatible. When they get married, if we can have the chart for the genotype testing, I would have been able to explain better.
I think my technicians could actually help us on that. I think
while they set up, I can continue.
Yeah,
explaining.
while they're working on the chart, you could actually go on with it.
Yes, like if the father and the mother both has AS, there is 50% chance that the children they are having, or any child they have, there is 50% chance that the child will have AS, that is half normal and half sickle hemoglobin, and there is 25% chance that the child will have SS. That is the fully sickle thing. And there is also a 25% chance that the child may have normal. But this 25, 50% and 25% chance doesn't mean that, like, when you have 4 kids, one of them may have sickle, the other one may be normal, the other 2 may be AS. This probability is each child. There is this probability that they have 50% chance of getting AS. That is when AS and AS get married. And there is 25% chance that they will have SS, that is the sickle cell disease itself. And there is 25% chance also that they will be normal, like they inherit normal from the father and normal from the mother. But you can even be unlucky that you have 10 kids and they all turn out to be sicklers, like having the sickle cell disease. It's just probability, chance. So that is how the genotype testing is. And it is for anyone who has SS, like the sickle cell disease, you should not even, it's highly incompatible to get married to someone who is SS, because in that case, your children, your offspring, is 100% chance that all of them will become sicklers, because both parents are having the sickle cell disease. There is nowhere else they can get the normal hemoglobin. And when an AS also get married to someone who has SS, there is 75% chance that their offspring will have the sickle cell disease, and there is 25% chance that their offspring will get the sickle cell trait. So it's quite important that anyone who has sickle cell disease should only get married to someone who has normal hemoglobin, not even someone who has the sickle cell trait.
So they can have at least children that are free from sickle cell. Now, I just want to ask one more question, because this thing you were talking about, premarital testing, it's something not very common in the Gambia, and you want to do that sometimes. You may have some challenges, either from the lady or from the parents themselves. You know, could you tell us a little bit about how do one go by this?
Yeah,
because most of us who are married sometimes don't even
probably
care.
Probably you don't even know your genotype, Aliu.
Yes, so that is a challenge.
Yeah, that's a challenge, but that's why we are doing programs like this, so that we raise awareness to the people, to the population, so that they can come out and do the sickling test. And sometimes when you do sickle cell sickling test and they find out that you are AS, and when it is necessary, they can also do more advanced tests like HB electrophoresis at the hospital. And the sickle cell test is not expensive. The sickling test, sometimes back, it was just $50 is the last time I knew about it. So it's quite important. You are doing this for the society and also for yourself and for your unborn children. Because like anyone who have seen how sickle cell patients suffer and the pain they go through and all the complications that they go through in their life, like some of the complications doctor have mentioned, you will be very, very particular about this disease and premarital testing.
Now, I'll come back to the testing again. Let me just engage doctor. Doctor, tell us, you work as a pediatrician at the Edward Francis Hall Teaching Hospital, which actually is the biggest referral hospital so that we have in this country. Give us statistics and tell us a little bit about your experience, working, in such a condition.
Okay, thank you very much. That's another important question. I've been in this system close to 15 years in the system, working as a doctor. I have a lot of encounter, a lot of sad stories. Seeing these people come to the hospital just to die. That's it. So after going through our statistics, that was in 2019, found out that we were carrying something like 365 patients at Edward Francis Moore Teaching Hospital. But over these 2 years, this number has increased to something like 500. That's it. So it has even prompted us to do a feasibility study on neonates to test neonates in selected hospitals around the country. And I found out that, the 1,000 tests that we did, 1.5% of them are having sickle cell disease. So if you extrapolate that to our national population, that 2 million that we have, that can be like something like 15,000 people in this country can be having sickle cell anemia. And then if you look at the carrier state that Sarata is saying, you found out that 15% of those babies screened were having carrier. So the implication is that like something like 150,000 people in this country can be carriers of that gene. And then those people, like if they don't know that they are carrying the gene, they can, also transmit to it or somebody else, and have, children with sickle cell anemia. So this is the importance of this, premarital screening for sickle cell disease, so that you know your genotype. After knowing your genotype, you can make a decision on who you are going to get married to. As I said, those if you know that you have AS already, you have to look for somebody with a normal genotype so that your children will not have the anemic state. That is the SS state. That is it. So and if you look at it, when you go to the hospital, you find out that every day, like a day like today, Wednesday, you go there, you find something like 40 patients waiting for you to be seen. They're like every Wednesday when you go there. Sometimes we all prepare ourselves for that clinic because every clinic, that is it. So if you look at what is going on in the country and Africa in general, if you look at Africa in general, they are telling you that something like 300 to 400,000 babies are born with it. Get it? That is it. Just like, Nigeria, Gambia, we have similar statistics. That is it. See? So, and then if you look at the death rate, they were telling that like if they are born that way without no treatment, 50 to 90% of them can die before age 10. Sorry, age 5.
5 years.
And if you look at their life expectancy rate, some of them is just less than 50 years. So it is a serious disease that all of us should put our hands together to fight.
Now, let me just draw you back. Yeah. You said if the baby is born within a week and there is no treatment done, the likelihood of that person dying at age 2 is very high. Now, how do you get to treat such people at that tender age?
As I said before, you can see the first signs of sickle cell disease will appear around 3 months, 4 months, 5 months. Not the first week. Because at that time they will be having what they call fetal hemoglobin, not the adult. So at that 3 months, that's when the adult hemoglobin will set in. So it's that adult hemoglobin that's having the problem. That's the abnormal gene. Yes, that's it. So as time goes on, what will happen? You see them will come in with this handful, painful swelling of the hands, come with fever and all those stuff. So what we do, we just try to treat that pain, and then maybe if there's infection, we treat that, and then make the diagnosis, counsel the mother on the need for them to be coming to the hospital. So once that is done, what we do, we just monitor and see, look for the symptoms, the signs and symptoms I'm telling you. That we try to look for them. So if they are becoming too much, what we do here, Gambia, we started giving them hydroxyurea. I'm happy that Ministry of Health was able to provide that and free, and then they are getting it. So we are able to give them those things once it's diagnosed, and then it is working very well for them. Yeah, it's working very well for them. So now what we lack is the transcranial Doppler ultrasound. That ultrasound helps to study their blood flow velocity. So to say whether this person is about to develop stroke or not. So that's what we are working on to get, so that we can be monitoring them at the hospital to prevent these complications that I've already mentioned.
of course, you are a senior health economist, and obviously this disease, like he made mention, is is costly, or it has some economic implications. Now, could you take us through some of these economic implications it has, both on the parent and also as the government?
Yes, the economic implications of sickle cell disease are quite numerous and quite huge, because like there is no study that was conducted in the Gambia about the economic implications of sickle cell management here, which I intend to embark on. But I have seen studies across Africa, like in Nigeria and in Kenya. The cost varies from $338 to $72, around that, $72 to $338. So you can see how costly it is to manage sickle cell disease, like some of the complications doctor was saying, and also the time that it takes the family to be taking care of the sickle cell patient, like the productivity losses. The mothers or the parents rather could have taken that time to go and work, earn something for the family. They take that time off to go and sit with these patients, these kids who are admitted at the hospital. If they are adults, you know, sometimes when they have crises or episodes, they have to be absent away from work. All those things are productivity losses, and that makes the economic implication to be quite huge. And also even the management cost is quite expensive, you know, especially when they develop certain complications like stroke, like infections. Sometimes they have a series of infections that needs broad spectrum antibiotics to take care of them, and with some of these drugs are quite expensive. So yeah, it's very costly.
So you made mention of a research or not conducted on actually the economic implications it has, and already you made mention of your intention to embark on this.
Yes.
Now, what could have led to that that research not being conducted? Is it that the Ministry of Health actually that you work for? I know you don't speak for them, but you work with them. Is it that the number of the statistics are not that high, or that will trigger some alarms for them to have a survey on it? Or is it that there are no partners, development partners, that are interested in trying to conduct the research? And what would actually motivate you to conduct the research on the economic implication as an economist?
Yes, the ministry is doing its best on sickle cell management. Like that is a knowledge gap, and most of the time, sometimes research, it's all stems from someone having the interest, like the way I have developed interest in this, in making a research on this area, and then finding out support from partners or the ministry. So sometimes it may be difficult if no one comes out and express interest to do the research to get the support. But I believe that we will get the support to do something like that.
Are you foreseeing any challenges along that line?
Yeah, so
okay.
financial challenges will obviously be there.
So now I'll come down to Doctor now. Let's look at some of the challenges on the fight against sickle cell in this country. You made mention of a machine and so forth, but
So as I said, you know, let me just try to help you with this question that was posed to. So as I said before, it was just something neglected. Not only in the Gambia, in Africa as a whole. So that's why in 2010, WHO Africa region make a declaration that government should do something about sickle cell disease, because it's something that is growing and then people still don't understand it. So where people don't know about it, you don't think of going to study, look for cost implications and all those things. That is. So now that they can see that we have started, so somebody is interested in looking at that area. That is. So can see that's one of the challenges that we have, because awareness, to raise awareness, to let people know about it. If you look at what we are having now, the pictures that we are having, father, mother will come with the child with all the symptoms that I have mentioned. That you do your test and you tell them the results, and then how, you know, the disease was transmitted to the child, and it was just like, you know, they don't know before. If they had known, you know, they could have just simply avoided the marriage. But now they have something like 2, 3, 4 children, and I know nothing can be done. Yeah. So that's the situation. That awareness, raising awareness, is very important. You know, before diagnostic facilities were also the problem, but I can see now we are able to get above that. If you go to Edward Francis Small Teaching Hospital, both the pediatric lab and the adult lab, you know, they can comfortably do the diagnosis for you. That is it. So can see, and then the medications for it also. As I said before, it was difficult. In fact, you know, but when we speak to people like Babandin Sabali, you know, who was the head of the National Pharmaceutical Service at that time, he was able to intervene, and then we had a lot of, you know, hydroxyurea, and we are giving to our patients, and you can see it has helped them a lot. That is happening. Yeah, so gradually, I think we get over all these things. So as I've already said, like, there are these rapid tests available, just like the pregnancy test. You can just do it on yourself, and then you know your diagnosis. It's also available. So if you look at this screening that we are doing, it's the ECOMET, is it ECOMET, sorry. And then, you know, what they call AQA laboratories who are helping us with that. Yeah, so they are the ones helping us, you know, to get that thing. So, like, we want those rapid tests to be available to all these hospitals, so that if a child comes with the signs or symptoms of what we are saying, they can just quickly do the diagnosis and then put the person in the pre-treatment. That's it. And then the transcranial Doppler that I'm saying also, that's very also important, but it's very, very expensive. So that's why
you were talking about very expensive. Could you give us an estimate?
Yeah, because you can see it is something that you want to because the last time, that was 2018, I asked for it, they were telling me something like $18,000. $18,000.
But so how much is the Gambian government actually buying?
So there's, you know, the problem.
When they have projects here, they buy new pickups.
You know, the government, they work with priorities. If you look at their priorities are many. That's it. So
Sickle cell is not a priority for now.
It's not like everything is important, but look at, they will also look at other diseases like, you know, malaria, which, you know, like everybody will get in a year. That's it. And then maybe other infections like everybody will get in a year.
You work at the hospital, you see some of the difficulties. You made mention of saying you see children just to come and die.
Yeah, that's what I'm saying.
Sure it must be very traumatic on your end. And then
no, definitely, they're very traumatic. Yeah, but I you know, notwithstanding, the government will still work with priority, and there are other diseases like maybe people with diabetics, you know, people with hypertension. There are many. And those people also will come and so they work with priority. So we, the people working directly with them, we are the ones sometimes we look for other sources of funding.
What efforts are you doing to push, because most of the decision-making people are not on the ground. They don't know what is actually happening on the ground. But you face the situation every day, and you know what is. What efforts are you doing to push so that at least the issue of sickle cell would be prioritized in the budget aspect of it?
No, that's what we are coming to do here on Friday. That we're going to invite all these policy makers. We sensitize them. We tell them, you know, the importance of, you know, paying attention to these things that we are saying. And then, in fact, what we want them to do, like, if they can come up with legislations, you know, that will even force people to know their genotype. And then maybe at schools, you know, when you are enrolled in any school, that they should ask for your genotype. That's like private school. Yeah, that's
going to be a very challenging task.
But you know, with the new interventions that we are having, like this SC that I'm talking about, you know, all those things can be done. It's done in other countries, so it can also be done here. Like churches and mosques also intervening. Try to tell their people that now, if you want to get married in this church, you will come with your genotype, and then they will cancel you. So now it is up to you.
But that has to do with a lot of awareness.
No, that's what we are doing. All this sitting here that we are doing is for that.
So
so that people know.
Let me get back to her quickly, because we will be running out of time, and maybe we will want at least 5 minutes for the listeners out there who cannot also understand the English. Madam, please tell us a little bit about your collaboration in terms of raising awareness. How far have you gone with raising awareness? How many communities have you actually engaged or visited?
Okay. How I came about this sickle cell awareness campaign is like a personal story to me, because I have an aunt who is married to an uncle of mine. They are cousins actually. So I can say 50% of her kids end up having the sickle cell disease, because both the mother and the father, because they are related. That's why the premarital genotype testing is quite important, but most especially for couples who are related, who are from the same family, because the likelihood, if a father is having the sickle cell trait and is related to the mother from within the same family, the likelihood of the mother having the trait is very high, because they are coming from the same gene pool of the same family. So this is how my aunt, because I have seen how much her kids suffered from this sickle cell disease. She has even buried 2 kids before their 5th birthday, and one currently, the third child, is disabled from sickle cell complications. So I took it as something personal to get out and educate people, because like doctor has said before, you just test the child and then test the mother and the father, and you found out that they have the trait. Had they known, they wouldn't have gotten married, but now they already got married, have kids, and they are having sickle cell, and it is already late. That's why we are so concerned and particular about raising awareness for people to take this premarital genotype testing seriously, so that they can do it for their unborn children to save them and to prevent sickle cell disease.
How far have you gone in your raising awareness? Have you visited any communities? How many of them, and what are the feedbacks from the awareness that you campaigns that you have embarked on?
Actually, I have not visited any community so far, but I have talked to close family members, as I know that we have the disease in our family. And I have been trying to collaborate with Dr. Makolo, and he has been very helpful actually, because anytime my family members get admitted, he's the one who takes care of them. And I have told him, express my interest in working tirelessly towards raising awareness about this disease, even from if I have to even incur the cost of doing this. And then the other issue is, like, I have seen some associations in the Gambia, like Sickle Cell Disease.
You have the Gambia Sickle Cell Association?
Yes, I have seen them on Facebook, and I have contacted them. I want to work with them so that we can reach out to communities, and then we can continue something like this, and we raise more awareness to the people.
Doctor, how far?
I think that a lot of work has been done. Yeah, as I said, we have the Gambia Sickle Cell Association.
They are doing,
they are doing a very good job. And then, we have also formed what they call the Association of Parents, fighting disease, sickle cell disease. They are very, very active people, because you can see now if we have a new patient, they'll be the one, counseling that parents of that new patient there. And then, we're working together to do things. And then, in fact, as I told you, we have gone up to Basse.
Have you visited?
Visited Basse to do some testing there. And then there's very, very soon the results will come out. It's the research result has been published, and it is accepted for publication. So very soon it will come out. Maybe when it come out, then we will try to share it. But a lot of work has been done around the country. So at least sensitize people there.
Tankular in Kiang is.
Sorry.
Kiang Tankular.
Kiang Tankular. Yeah, I heard about that story.
Is termed to be the highest number of sickle cell patients, which each family having a carrier. And the problem you made mention of intermarriage. Cross families is really affecting. Are there any plans for you people to visit the place? And also, again, as somebody who has been working or attending to patients of sickle cell, you having any plans to inform the government? Because at that village is almost off the road. They do not even have a hospital. The only time when it's affected, they have to rush to MRC in Kenaba.
Yeah, no, that's it, because I can see just recently, at the same locality, the government, they built a new health center there. That could be another strength for us. So what we are planning to do is to train healthcare personalities on how to manage cases of sickle cell, detect and then manage them. That's the new thing. Like immediately after the newborn screening now, we know that they are prevalent in those communities. Healthcare workers in those communities should be trained on how to manage them. If they have difficulties, they can call, and then we will intervene. We will help them to intervene. That's the new strategy that we want to see.
So just a quick one now, because we have people who are there, Mandenke, our local people, and they'll be very interested in knowing the discussion here, looking at the literacy level in the Gambia. So maringom na min kacha kanjang nga mofulale soto jang, wolom Dr. Makoloti, aning Sarata Ngak, ñul bebe Ministry of Health bota jele bi ila na jang wolom inata pour nga sickle cell screening na famu munelti. So diamo ñing aka dia amari so Dr. Makalo experience da meta ñin doko la sa ñan naftale inin na mandinka juberlal wona mol mi yalon ko be jubero la banta ya fo gale in short minute munom ñin sickle cell ti aka mum bata sifale la mokan anun anin kudol dal.
Okay. Sickle cell momenti wala ñintu ko courant me yalon ko aka yela dingol akol lal mantora fende me yalon ko courant de from me yalon ko e ka soto mo ka soto abama na fama aka soto lal bala so ba ko ning eti asoto joron me yalon ko be yelo kono e ka fonyo bodi yela dingo bala ka samba kata bala jaatol ñing kol fulol fana si mu nafala o joron ñing akol tinya be nawo tinya ba ko yela dingo ñing ako fana tinya ne yela dingo jibe aka muntala ko karotil tan dano be ñamen bot ning mo joron ñi men kay fonyo samba yelo ñing kono nawo tinya rek ba la ka yela dingo ñaka tinya so na tinya aka tinya nyama ko mundo ko worto be nyame wala ne ka fa ko to wala ka fa sickle cell ne sickle worto jiba beten deden ya ka wa ne ko so yela dum fana kamul wala nyama aka tra tinya la sa ibale ko yela dum na ta ko nga betaren asta fo til keme til muang wa because of in tinya ro men katala aka ta fo til tang wala til muang ya fam so no kada ibala ko ayi sef mbenta tan ko katina fonga pride dung tama yelo ko na ko le abul bage saja sta sakin plato nakin nyola ya yo yelo sulo ñu suki so wala ko dimo ñim bala dimo men bebe kikante wala ka be samana so bi ko fa yelo ñu fen ka trayati nyala juna gene nji ay lo ka tra mankila saja nyaatra neta mun ko kan andani wato do be ni dindemu kar saba karndani saja abulo start kayiti a sungul fana kayiti ndaka dimi mbake otamo no alfadol bafulo na dinu bloka dimi nyama kayiti nyama def mo jakal dal istra dewnding ya fam so baylo ko na bodoto yeni je saje wato do beje hani ni stroke men keke asi kun kemoti nya stroke men kaje ke baleten saje dindi merem aman sanje fla fonsi a soto isaye wato do fon beje because of courant kiso nyim because of courant kiso katra kutule no jurala ni la kulul fon kuran kiso abitinya ya fa wato do beje saje suñu dimu courant ten wato beje ni josu kolye bulo kono ajal o besikeno an wato beje kay se kono fifi ayiti because of su fol mi lan ko be kono wato be wato bitinya la ya fa an wato beje saje hani singus fonsi madi mosuro madi mo melan ka jarro fon ko kolya an wato do beje nin kam kewlam saja kema akyaye do abuka jindino ata fon buka jindino afayno afa hay simu nake abuka jindino afayno fo ta loptano do ya mo koy prayeji so nu ka ba continue de ka jawata mo don fa fo kiyal aya so wana sikur la mantoro jawata anu ni aji be fo jama fon beji ni ata imang jara rosoto jandi ba fula sanji be sanji lulu soto la saje ko kemo keme tal lulu fo tankondo be bang ani ni aji be fo ko ba hada ko mo ke bata fo ni ata man jara rosoto jama e ka ila ibuka sima no a betea ko araba dum do ko sima no nyama ko la waro do be pour do jama fon tambe sanji tal lulu la ko kole abakel fam dol be jel mela ko e tambi wala bo ngam modol jel mela ko ita fo sangi tankondo ne fenge be balukan so wala mo ba ngana ka lose hope so ngina musiku sella ko di ngina mala problem golte so wala sa pour mo be ngende haklo to la pour ngam ko pour que fan jibe janni atre be futula ke la yelo jibe mo yela sifal betala sa ye simmo ni me yalan ko amang ni ngata kuma betala ita ma ngena sonna pour ye futu mo do me yalan ko abo funa yelo kon wana ro futu rek wala mi ka ding e chance sotole afana ñu ko ro ñina so ngina ma kumba
so malam fo sena ba ka mande ka
sarata
sorry malam faka mande ka kan ofole
sura kan
I can speak Mani, but let me just speak while he has already spoken.
Okay, so saying sarata mune mom degut sose mom dina laka si lini si all of bi so yow sarata legi luñ bëggon nga wax gaay moy lan moo ta mu am njëriñ pour balaa ngay sëy nga dem test sa genotype pour xam ne feebar bi ki docteur bu nekk di ma mooy sickle cell borom mun na ko avoid.
Okay, just quickly, I would like to mention something about testing, sickle cell testing. Like right now, it is part of the routine antenatal care test to be test for sickling, to carry out the sickling test on every pregnant woman who goes to the hospital. It is one of the ways that we have also found.
Okay, that's a new conclusion.
Yes, that's
okay,
quite important.
So we could go to the local language show you, because we're wrapping up on time now.
Okay, good.
So I don't know, like if you could just nisa formule munatina important pour ka testing ke before ibe futola.
Yeah.
And in manika kango sutia then ngana sura kango fa demanding nga wrap up because wato tije sign.
Ko jani mo ko fudu ka ta testing aning sickle cell kurangola akuma ya tabake munatina because sickle cell training AS jama akatara tubabo kamin for asymptomatic ala ma nying mandaro buka finti sa ika soto le tumado fo ikeba ya tumado do ka tara jang fo e fafang ni ma test ibuka long because ibuka abuke mantora sa is akumata yeta test because training sickle cell trade coming half sickle na bela ye futu ani modo mi yalon ko half sickle bala idingo comme keme moanin lulu chance beje comme iba soto la isi unlucky fang ye dingo soto isi ding tan soto fang ibe sickle cell soto sa wala tina akuma yata janni mo ko futu yeta nyin testing ke surtout futu mi yalon ko badi futu lem as kume ata bake pour kata nyin testing ko because ni sickle cell trait soto ani kema fo I muso I bota family killing wo fana ay trait soto comme there is likelihood there is high percent chance that ate fana be trait soto because al tol be bota family killing
okay sign doctor last question on wolom ning aljomal nin jumala ale amalu lum balati al lafta fenne soto la mi alon ko albe wo jurala isa fo mole munata na nin lungo nin akumata tol fe ando mune be kala je wo lungo
so lungo nin akumata bakele because lafta bengala wala ngindi ko ka mol la faham bo nin ka lafa yalo munamu sickle cell disease aka soto nyadile andi simula fanan keno pour ye fan tankala afam so wolum fanan ibaylo ko ba mol kuma la mel yalan ko kumata nyun ko kono pour ka mel ka yalan ko kantier le mudu banko kan esi nana ngol nga kuma nyum fana folie sa ja seniama isa ko ni be decision kala si ngamben ka mol mel foye esi fan kandala so anumbe mol fana be free testing fana kala mo mol mel yalan ko kuma ko funding kel ko mel yalan ko futu dal bo futu ko no fa pareta bo mol mel yalan ko man futu folo no lafta pour ko nyatle wala ko fana test ke be jibe and so nga fa am te nyame at least maybe mo keme fula fo mo keme sabanyo wanda donol nyen ko nga fo nyame okomet aning AQA wolen donate le o testing material la so tumodo ngaji ko tumodo bat up to 300 tests sa okay no Friday so wala ko fona mo mol makala pour ya faham ko ngi courant be kedene and then si fantan kan wala sinano pour kuma ye fan test and hana man kuma ga man soto bla fo no fo sta no dula mento ya soto yeah
sai ila kabiri be angala ka fo jang ya fule ko courant nyi dépense hapo amantara bankola dépense ba kono katon ko iko mansa kunda ye priority dole soto sai nafta lon na mulom comme lungo nyi bayro albe kunu kumbale kumande la mol mi yalon ko kango be la nyi banko kan falbe nyi kuma alba fole kato ite every lungo lung ene nyi mol be nyoko na ya foy kan ikanale ikamol jel mi yalon tindi mereng ibe fala so ma laftale kalon fo nyin kumo nyin alba sahani ande alba bamande gal kan andum fanan falbe mutala pour ye lahido di ko dépense o nyin gambela dépense ba kono nyin ko nyin courant nyi abe tarraje
no sorry just pour ko nyin senade no fon fi anan ko biran ka jara lopta notul abebe masa kunda dépense ko to ya fa so mo bi ka be dépense de ko ba din ka fo meno ko ngo ni ajibe fanan ka problème mo ka jibende ya jibe jumana adu kana ko kulindo ko nga ngenda lon nako gomo gambe mu foara ba golti ya fa so ta keno ko ngo america nyol be jame wol fe ngol biye bulle yawn sane mi alan ko kay ko ke no jaan fam so fo kuma ni be ko do fana bondila masa kunda ko jibe ka bondi wala nyam ya fam so wala ne ko man do men fana be do ko nga understand wo nyamal ko foara ba ko lam ifana nga nyom bende wala mnyinde ko fam frending ya be no banko dingole ya fa nga nyom wolti ajal so ba ko man do men fana be do ko le ko to fana ga jibe no le ko man ko isi fana de dulal men tekino nga fendi bondi ya fa ko man ni ajibe ministre of health ta ecomet kay nyine ka fo ko alenso ya fa ba ko man des tano jela nga fu ko alenso ya fa mo de ba ni wala fana na ya jibe ba ke ba fana be do ko la janne so fana na ga men corporate social responsibility pour ka intervene no civil so kuma mol be na kol ba nyoko na wala nyama ya fam so to fana kata ba interaje nga ngedani fana ya jibe fana responsibility soto towards the citizens of this country so fana mbolo imaje fana be nata ka edina ko ba ku din kende rek fana mbolo tande ka kare so ni are fana modo lo me an ga fana si makoro keno fana nana makoro ke in good faith ya fam so nga continue wol jam so that's the way we operate
so ma summarize
okay legi mun nga ko summarize because time amatul legi
ala fi ni mëna diga waaw jërëjëf tey dañ ñëw fii nii pour waxtaan si mbiru feebar bu ñoo ooyee sickle cell feebari sickle cell dafa nekk feebar boo xam ne dañ ko dee doona si ay waajur la dee jógee si yaay bi wala si papa bi wala si ñaari waajur yi yëpp sickle cell bi lan moo ko dee waral moo nekk ne am na luñ dee ooyee hémoglobine si deret bi moo de hémoglobine bi moo dee jël ngelaw bi buñ dee nokki jël ko di ko yóbbu si suñ cër yi si biir yaram bi léegi hémoglobine boobu noonu dafa bindoo comme weer soo ko xoolee si microscope bi waaye su nekkee ne nit ki dafa am feebari sickle cell bi du dee mel ni comme weer daf dee mel ni sarta moo tax ñu anglais di ko wax sickle cell disease sickle moo nekk sarta su ko defee su melee noonu ni mu war a doxee si biir yaram bi hémoglobine bi ni mu war a doxee si biir deret bi dem si cër yi du dee mën a doxee noonu daf dee jafe dangaa gis yenn saay fi mu war a jaar dafay fatt ndax ni mu bindoo moo tax ni mu melee ni sarta su ko defee fatt boobu daf dee indi jafe-jafe yu bari si doomu aadama bi jafe-jafe yi comme yu bari yu fi docteur wax bari nañ yenn saay dangaa gis xale bi mun naa am acute chest syndrome moo nekk dënn bi mu mel ni lu fatta pour nokki bi sax daf dee nekk problème dangaa gis yenn saay xale yi seen loxo yi dañ dee néewi seen tànka yi néewi seen yax yi di métti seen yaram bi yëpp di métti ñu ngi yuwu ndax lii bi moo dee tax fata bi si biir deret bi moo tax moo waral loolu yenn saay si mag yi sax dangaa gis yeneen góor yi dañ dee dem yenn saay seen góor yaa mu taxaw du mun a daanu du mun a wàcca ba dañ dee dem lopitaan sax ñu def yeneen intervention yi pour mu wàcca loolu daf dee tax ba ñeneen ñi dañ dee dem ba ñàkk seen ngóor yaa loolu yëpp sickle cell daf ko dee waral yenn saay dangaa gis ñeneen ñi dañ dee dem ba mun a am stroke ndax deret bi yooyu fata bi moo fata si biir boppa bi deret buy jaar si boppa bi su fatee mun naa jox borom stroke complication yi jafe-jafe yu sickle cell di def si doomu aadama bari na moo tax ñi ne fagaru moo gën faju loolu moo tax ñun ñu ngi jóg taxaw pour wax ak askan wi wax ak waa réew mi ñuy def test bala ñu dee sëy nit ñi bala ñu dee sëy nañ dee def test ñu xool ndax am nañ feebari sickle cell bi ndax sickle cell bi ñaari façon la am na sickle cell trait bi moo nekk lu ma dee ooyee half sickle bi ak sickle cell disease moo nekk full sickle bi dangay gis ne ku am half sickle bi genn wàlli hémoglobine bi dafa correct moo nekk baax na waaye geneen wàll gi dafa mel ni dafa am sickle bi su ko defee boobu noonu mun ngaa dundaa moom ba xëy dee sax boromam du yenn saay ñu bari si ñoom duñ dee am mandarga mooy lu tubaab bi dee wax asymptomatique su ko defee doo ko xam soo demee nag soo amee trait bi nga dem sëy ak koo xamante ni sa mbokk la su nekkee ne si benn famille ngeen jógee there is high chance ne yow moom soo amee trait bi moom tamit mun naa am mu am ko su ko defee yow nga am half sickle bi kooku am half sickle bi seen doom su amul sens dëgga mun naa jëlee half sickle bi si yaay bi jëlee beneen half sickle si baay bi ndax doom dafay jël half si yaay jël half si baay su ko defee ñaari half yooyu su leen dajalee boole leen moom mu am full sickle bi nag su ko defee moom dafa am sickle cell feebar bi mu nekk di am jafe-jafe si dundaam di am jafe-jafe si dundaam moo tax ñu leen a ñaan di leen xañ lii tamit ñaax dëgga ngeen a def test di xam sickle cell bi ndax mu ngi seen yaram ndax nekku seen deret bi bala ngeen a sëy baax na jërë ngeen jëf.
That was very brilliant of you, and then it was smart. We don't have much time. Just to wrap up, in 30 seconds, Doctor, what would you have a message for the Gambians or for those people actually viewing on the issue of this sickle cell?
So what I would tell our listeners is that sickle cell is in the Gambia and is very common. So people should do everything to screen themselves to know their genotype before they will get married. And then if they see any child, suffering from the symptoms that I've mentioned, they should quickly come to the hospital. That treatment is available, and then we can prevent the development of those severe complications that I've mentioned.
Saratha, your final take on this program before we wrap up?
Yes, I would like to reiterate the importance of premarital testing, as Doctor has rightly mentioned. Genotype testing is quite important, and I would also take this opportunity to call on the people, the public, and especially the religious leaders. Like in some other countries, we have seen, I have even searched on the internet, I have seen that even in Saudi Arabia, you present a marriage, a medical certificate before you get married, which includes genotype testing. And also in some places in Nigeria, in some churches and mosques, before they try any marriage, you have to present a medical certificate, which includes genotype testing to see whether you are compatible or not. So I would also like to call on the religious leaders to take this premarital genotype testing quite important and take this message to their congregation so that we can reduce the prevalence of sickle cell in the country. Thank you.
Well, the emphasis is premarital testing before getting married And they're also calling on our religious leaders to actually, ask people, or before they tie the marriage, to ask the partners to present a medical certificate before. Well, viewers, that was all we have for you. Do join us next time, and don't forget to join them on Friday to go and have yourself tested. What we have not actually told the viewers where the venue would be for this particular event.
It's going to be at Edward Francis Small Teaching Hospital, Department of Pediatrics. Yeah.
On Friday at the Edward Francis Small Teaching Hospital is a place to be for you to go and get a free screening on sickle cell. Well, that was all we have for you. Do join us another time. Thank you.